Okay, thank you very much. Welcome once again. This time around, we are going to demonstrate how to dismantle the MVA aspirator. First things first, it depends on, there is no specific documented stage that you should start with or approach that you should start with. You can either start dismantling from the other end or first to separate this aspirator from the cylinder and the flange. Okay, you can come here and remove the cap. For you to remove the cap easily, there are these two protrusions which you are supposed to press.
Maybe maybe the camera should
Okay,
visualize
let's
properly.
yeah,
Maybe this side.
yes. You can see here. This is it fully assembled. Now we want to dismantle it. First things first, you can easily detach here. There are two different parts. Next, there are two structures protruding here which you can simply place, push in like, then to be easier for you to remove the cap. You can see? Push in these two protruding structures, then remove the cap like this. Okay. Thereafter, you can come and flip this out. There's a provision here where you can put your thumb. Hold it firmly. You put your thumb, right? Like you're opening up a groundnut shell. Okay, a groundnut shell. Hold it there. Open. You have opened the valve. Next, you can remove the valve liner. Valve liner. We come this side. Remember, you cannot remove the plunger direct from the cylinder because there's a stopper which is preventing this plunger from coming out the cylinder easily. So the best thing to do at this point in time is first to remove the stopper, next stopper here. This one. After this, you can easily remove the plunger. We have dismantled everything. This one, assembly is very simple. Valve liner, target this area. Okay, there it is. Then simply flip this one over and we are good to go. Okay, a cap, see the correspondence, a cap, fit it like that. Next, plunger into the cylinder, making sure of alignment, stopper here like that, just fitted, preventing the plunger from coming out of the cylinder. Next, make sure this structure faces you and the readings on the cylinder faces you. And make sure that the alignment of the protruding structures, this one, the buttons, the collar, and the wings of the plunger are corresponding, are aligned nicely. This one facing you, readings facing you, the alignment should be nicely done. Okay, should correspond. Once you have assembled like this, don't forget also to do a quick testing if it is able to maintain a vacuum. We agree. Go in, push forward, aspirate. What you've just done is referred to as charging. We have just charged the gadget in readiness for use in the patient. How do we know that we have achieved the vacuum in there? We simply press the button. You can hear the sound of rushing air into the cylinder. That's the confirmation you have to say it is able to charge, meaning it is now ready to be used on the patient. The moment you find that, you discover that it's unable to maintain the vacuum, please look for another gadget. Never prepare a patient that then before you need start, find that the gadget is not working. It's better you test that in advance before using it on the patient.
Thank you very much. That is Mr. Chuya. Okay, so you guys, I think we have learned a lot about how to assemble the vacuum the aspirator, okay, for MVA. So as you attached to that, maybe say that department, you attached to conducting the MVA room, that's under guide, should be able to at least assemble or at least assist in MVA procedures. So Mr. Chuya, before we go, what are some indications for conducting sleep?
Good question. Good question. Um, Basically, there are about 4 or 5, or there may be more than 5, more than 6, but I'll mention just a few. First things first, manual vacuum aspiration is indicated for managing incomplete abortion. Incomplete abortion is where by one had conceived, confirmed, and established pregnancy, then all of a sudden the pregnancy go bad, part of the products are expelled to the outside. Then whatever remains inside the uterus, whatever is retained inside the uterus, we call them retained products of conception, which is equivalent to incomplete abortion. If all these things had come out completely, we would have termed it as complete abortion. But now there is something remaining inside the uterus, something that have been retained inside the uterus. We call it is incomplete because some things are remaining. So the indication, one of the indication for MVA is the evacuation of RPOs, retained products of conception from the uterine cavity. Another indication is to manage an induced abortion. There could be other findings that may compel the gynecologist to actually induce an abortion in the human, in the female. So induction of an abortion, termination of pregnancy, you can actually use the same gadget. 3, a missed abortion can be managed by the same gadget. Of course, bearing in mind the gestation age, you remember in missed abortion, all the features of pregnancy tend to disappear. A woman will tell you have missed periods for 5 months. You try to palpate the abdomen to feel for the height of fundus, you find that it's not corresponding with the pronouncements made by the woman who's pregnant. All the symptoms of pregnancy disappear. So check the ultrasound scan, it actually tells you it's an missed abortion. So whatever products of conception that are still developing in the uterine cavity, you can aspirate them using this one. Also, a molar pregnancy. Molar pregnancy can be managed by use of a manual vacuum aspiration gadget. But remember, with molar pregnancy, you have to take precautions. Molar pregnancy, you expect a lot of bleeding. So this time around, I understand there is a precaution that all molar pregnancies should be managed in the operating theater using the same method, but in the operating theater where you have all gadgets for resuscitation, just in case you encounter massive bleeding, excessive bleeding. So molar pregnancy can be managed with this gadget, except it should be done in the theater. Another one, when you are collecting an endometrial biopsy. Endometrial biopsy, any tissue structure that you would want to extract, to collect from the lining of the uterus, you can actually use the gadget. Because with it, you are going to connect a cannula. Remember those cannulas have got some holes in front. So as you are trying to evacuate, cleaning the uterus, in the process, you end up collecting part of the tissue from the uterus lining. So it's used for collection of endometrial biopsy. So I think I've mentioned management of incomplete abortion, evacuation of RPOCs, missed abortion, induction of abortion, TOP, termination of pregnancy. Then you can also use it for management of collection of endometrial biopsy and also molar pregnancy. About 5 indications so far.
I think they're enough. Eh?
Yeah,
Yeah, thank you very much. And you guys are starting more to find out the indications.
Yeah, there could be some more.
Yeah.
Yeah, but basically these are the most common ones under which these gadgets have been used. Can I also mention 2, 3, 4? There, with every procedure, with every surgical procedure, there are complications that are attached to this. One of the commonest complication of manual vacuum aspiration is bleeding. You will encounter a lot of bleeding depending on how you conduct this procedure. So one of the complications is bleeding. You see after finishing the procedure, you see bleeding will start coming out. It could be that provoked something inside the uterine cavity where now bleeding is coming out profusely. So one of the complications is bleeding.
Yes.
The other complication is perforation. When we shall come to conduct the actual procedure, to demo the actual procedure, we shall show how you can end up piercing through the holes of the uterus. Perforation is one of the complications. In the process of you cleaning, you can end up accidentally pushing the cannula, which can end up piercing through the holes of the uterus. And the intestines will now, instead of you suctioning the RPOCs from the uterine cavity, you end up suctioning the intestines. You see, with you, what you're suctioning RPOCs, and yet you have already protruded into the abdominal cavity, collecting the intestines. You only see intestines coming out. It's rare, but it's there. It's one of the documented complication. Also, there's infection. Infection in most cases comes in when you, as a provider, you don't pay particular attention to the principle of sterilizing instruments. Imagine you mentioned to say the uterus is a sterile kind of structure. Inside the uterus, there's sterility there. So if you end up using instruments which have not been sterilized to the standard, it's you, the provider, who end up introducing infection into the uterine cavity to the patient. After MVA, you see a day or two, patient starts spiking, start experiencing hyperpyrexia, fevers, running fevers. Just be mindful to say there is a possibility that when you are doing this procedure, you did not adhere to the use of sterile instruments. Hence, you ended up introducing infection into the woman's uterus. So basically, infection, bleeding, perforation. Also, there is what we call um, underperformed MVA. You go in, you start aspirating, all of a sudden you convince yourself to say, things have stopped coming out. You even stop to say, I've evacuated, and yet you've left RPOC so underperformed, meaning you have not evacuated everything. So if those things remain inside the uterus, they are going to start decomposing. Then the name of abortion will change to septic abortion because those things you left inside. There are raw pieces which you did not completely evacuate have remained there. They have continued decomposing. Then the name of the abortion now it will change to septic because those things they will go bad. The patient will develop sepsis. So one of the indications, complications is underperformed MVA, which will result in unsuccessful evacuation of the uterus, which in turn, those things which are remaining, they will start decomposing and the status of an abortion will change to septic abortion. So these are basically some of the complications that we witness when we are conducting these procedures.
Thank you, guys. As you have heard, there are a lot of issues that are involved in performing the MBA. So as you perform, bear in mind what Mr. Chube has brought to us. And thank you very much. Keep watching, keep training, and at least learn more about these things. Okay? So try to be consistent as you go to the work.